Namaste Vidya, हमेशा खुश रहो बेटिया. A very good morning to you all. Myself, JVM Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine in Faculty of Homeopathic Science in Jyoti Vidyapith Women's University, Jain. In today's lecture, we are going to discuss about another important clinical examination. Alright, so this is the clinical session, and today we are going to discuss about general physical examination in a patient. So how we are going to perform the general physical examination of a patient? What are the various steps that are needed to be performed whenever a patient is coming to us? So there are certain steps that you need to follow in order to perform a general physical examination of a patient. So first steps. In first step, you need to look at the facial appearance of the patient. Just by looking at the facial appearance, you can get an idea about the disease condition. There are many situations where you can get the idea of the disease of a patient just by looking at the facial appearance. Sometimes the patient is having moon-like face. The face is swollen, moon-like, and the general symptoms appears of that of Cushing's syndrome. Sometimes there can be swelling on the face. The swelling that is apparent in the morning and it disappears after some time. That will guide you towards nephrotic or the nephritic syndrome. Sometimes the patient can have masked facie. Masked facies means without any kind of expressions on the face. So this will be present in the disease like Parkinson's disease. So many times in gigantism, the appearance of the patient will be huge. The hands will be larger like a spade. So the appearance of the patient will give you an idea about the clinical, about the disease condition that a patient might have. So this is the importance of appearance. Whenever a patient is coming to you, then you have to first of all look at the appearance of the patient, and that will many times give you an idea of the disease condition that a particular patient is having. The next important thing is the complexion. First of all, you have to look at the facial appearance of the patient. The appearance in general, you can look at the patient. Then you have to look at the complexion of the patient. There are major two types of complexions. One is the fair complexion and the other one is the dark complexion. These are the two major complexions that we see in our society. The complexion is basically the color of the skin. There are many factors that are responsible for providing color to the skin. The factors like melanin pigment, the other factors like environmental factors, the climatic conditions, the temperature of the particular place, that many times decide the complexion of a patient. So first of all, we have to look at the facial appearance of the patient. Then we will check about the complexion of the patient. How is the complexion of the patient? Whether the complexion is fair or it is dark. Many times you can see the pigmentation on the face, like especially in the case of closma in females. So these are the various pigmentary disorders that occurs due to the abnormalities of the melanin pigment. The third important thing that we are going to observe in a patient are the state of clothing and personal hygiene. Whenever a patient is coming to you, then you have to observe for the clothing. What kind of clothes that particular patient is wearing. If the patient is mentally disturbed, then his clothes will be very much dirty. The buttons will not be proper. There will be soiling of the clothes by stool and urine. So the clothing will represent any kind of neurological or psychiatric disorder that the particular patient is having. And personal hygiene. Personal hygiene represents the cleanliness. The level of cleanliness a particular patient has. Alright, so if you are going out for any kind of function or for anything, then you are dressed properly, you are grooming yourself. But in case of a mental or psychiatric disease, the patient does not care about the cleanliness. Next, the fourth point, we have discussed about the facial appearance of the patient, how the facial appearance looks like. Then the complexion of the patient. The complexion are two types. One is the fair complexion and the other one is the dark complexion. The third is the state of clothing and the personal hygiene. So, what are the types of clothes a particular patient is wearing, and also his personal hygiene or personal cleanliness that you have to observe in case of general physical examination of a patient. The fourth step is then you have to check for the mental state and consciousness of the patient. Whenever you are observing a particular patient, or if a patient is coming to you or is brought to you, then first of all you have to check whether the patient is conscious or is unconscious. So if the patient is unconscious, then he will not be able to respond to the various stimuli that we have given. He will not be able to answer to your questions. But if the patient is conscious, then again two things can happen. Whether the patient is cooperative or the patient is non-cooperative. If the patient is cooperative, then he or she will respond to your answers in a good way. But if the patient is non-cooperative, then the patient will not answer to your queries as and when you are asking from that particular patient. So, this is very important point, the mental state and the consciousness. Again, in mental state, whether the reflexes of the patient are proper or not, whether the patient is answering to you properly or not answering to you, these things have to be noted down. What are the different kind of answers that you get from the patient has to be noted down. The fifth point is very important. Whenever a patient is coming to you, then you have to check for three things. Number one, his posture. What is the posture of the patient? Whether he is coming to you, whether he is standing straight or sitting straight, or there is any kind of deformity in his body. Deformity in the hands, deformity in the feet, deformity in the spine. There are different types of deformities you have studied, especially in relation to the spine. You can have scoliosis in the posture. The deformities can be scoliosis. There can be lordosis, and there can be kyphosis. So these are various deformities that could be observed in case of a patient who is coming to you with a spinal disorder. So there can be kyphosis. Kyphosis means ऊपर निकल जाता है. ठीक है. Lordosis, when the chest comes forward and the patient walks like a lord. And then scoliosis, when the spine is having a lateral bend. Then comes the gait. What kind of gait the patient is having? Gait is basically the चाल. Patient किस तरह से चल के हमारे पास आता है, that is gait. Whether he is walking normally. Suppose I am walking normally away from you and towards you. So my gait is normal. If I am not walking, if I am walking like this, that means my gait is not proper. I am having some defect in my gait. So the gait has to be checked for. And any kind of abnormal movements. Abnormal movements like involuntary shaking of the hands or involuntary movements of hands or feet that should not be there are observed in the patient. So you have to check for the posture, gait and abnormal movement. I will again repeat these 5 points because these are very important. Whenever you are doing the general physical examination of a patient, you have to look for the 5 important points. Number 1, you have to look at the facial expression of the patient. Many times when the patient is coming to you, he or she may represent with the features of pain, agony, restlessness, that could be seen on the face of the patient who is coming to you. Then the facial expression appearance may give you the idea or the hint towards many pathological conditions that I have already discussed with you. The complexion, two types of complexion that I have discussed, the bright complexion and the dark complexion, from which you have to check for the patient. The state of clothing, different type of clothing that a patient is wearing, and his personal hygiene has to be checked for. So you can either see these conditions of the patient, or you can also inquire from the attendant of the patient regarding these things. Mental state and consciousness has to be checked for. Either the patient is conscious or unconscious. If he is conscious, then he is properly responding to you or not responding to you. Then posture, gait and abdominal movement. You have to check for the posture of the patient. What is the posture of the patient? Is it proper or not? The gait of the patient. Gait means whether the patient is walking properly or not walking properly. Then the third one is abnormal movement. Any kind of abnormal movement that you observe in a patient have to be noted down. So these are the 5 points that I have discussed. Now we will be going on the 6th point of doing the general physical examination. In the general physical examination, we further have to know the sound, voice and speech of the patient. Sound. First of all, sound. There are different types of sound that could be heard in the examination of the patient. If you normally apply the stethoscope on the abdomen, then you will hear about the various Godwin-Ramos sound, that is the movement of the bowel movement. If you apply the stethoscope on the chest, then you will hear the breathing sound. If you apply the stethoscope on the cardiac region, then you will hear various kind of cardiac sounds. So there are various normal sounds and there are various abnormal sounds. So these sounds will help you to distinguish between the abnormal disease condition and the normal condition of the individual. So you need to listen to all the different types of sounds whenever a patient is coming to you. Not only auscultation, but there are various sounds that you listen by doing percussions. Voice. Voice is produced by interplay of various organs, like the use of tongue, lips, nose, larynx and voice box. All these things combinedly produces your voice. So you have to check whether the voice is normal or is it subnormal or abnormal. Again, in the abnormality, you have to check whether there are different types of abnormalities of the voice. Like it can be husky voice, there can be hoarseness of the voice. So, voice can be hoarse, it can be husky. There are n number of types of voice that could be present in the patient with various kind of diseases. So you have to check for the voice, and then we will have to check for the speech of the patient. How the patient is speaking with us, whether the speech is characterized by the language proficiency, how the patient is speaking, what kind of language that particular patient is using, that determines the speech. Whether the speech is fluent or it is stammering type of speech, this we have to note down. There can be lisping. Lisping means to climb. Then next, after this checking for the voice and speech, we have to check for any kind of odors or smell from the patient. As I have discussed earlier, when we check the personal hygiene of the patient and we have checked the clothing, at that time also I have mentioned that the patient can have multiple disorders due to which there can be incontinence. So if there is incontinence of urine or stool, then there will be offensive odor that will be coming from the patient. Again, there can be disorders in the perspiration. There can be problems with the perspiration perspiration or the sweat of the patient, that can be offensive in odor. We have variety of smells of the sweat which represents a particular homeopathic medicine. So for a homeopath, the smell or the odor are very important. There can be offensive odor that is coming out from the mouth. The term for that particular odor is halitosis. So halitosis is basically what? Halitosis is the offensive odor that is coming from the mouth. So halitosis, we have to check for the smell. The smell or the odor that is coming from the mouth or the body. So we have checked about different things. Now in the next point, what we are going to check? We are going to check for the build or physique of the patient. The patient who is coming to you in the general physical examination, you have to check whether the patient is having a well build, is the nutrition proper, the age and height ratio are normal or not, whether the height and weight are according to the patient's age or not, whether if the age and height and weight does not correspond to each other, then we can say that there is some kind of disorder or the disturbance in the patient. So we have to check for the build or physique of the patient, whether the build is proper or not. Is proper build? Is there any kind of problem that we have to check for? We have to perform various kind of tests for checking out the disturbance. If there is any kind of disturbance we find in the case of build, whether well built or not, is there any kind of deformities in the eyes, in the ear, in the nose, in the hands, in the feet, that you have to check for in the general physical examination of the patient. The physique has to be checked for. What is the physique of the patient? Whether the patient is lean and thin, whether the patient is obese, what kind of physique that particular patient is having, you have to check for all those things. Next is the measurement of height and weight. So whenever a patient is coming to you, especially in case of children, you always see that there is a growth chart. You might have heard about this growth chart in your obstetrics and also in the community medicine. Growth chart is a chart that mentions the age of the patient or age of the child on one side and the corresponding height and weight in the tabular form on the other side of the sheet. So that these things have to be measured or have to be marked to check for the proper. There is a growth curve that decides whether the growth of the child is proper or not. So we always have to check for the growth chart, the growth curve, especially in case of children, whether the growth is going on proper or not. So we have to measure the height and weight corresponding to the age of the patient. What are the various criteria, what are the various parameters that have to be checked for? While assessing the weight, especially weight, there is a criteria known as the BMI. What is BMI? BMI is basically body mass index. What is the body mass index of the patient? And if it lies in a proper range, that means the patient is okay. If the body mass index is not proper, does not lie in a proper range, that means the patient is either obese or malnourished. BMI is represented by weight in kilogram divided by height in meter square. So when you divide this ratio, then you will get the BMI, and that range will help you to decide whether the patient is in a normal range or not. The normal BMI ranges from 18 to 24 kg per meter square. So if the BMI of the patient lies in the range of 18 to 24, that means that particular patient is okay. But if it is more than 24, that means the nutrition of the patient. So, measurement of height and weight plays a very important role. You check for the different height and weight of an individual are corresponding to their age, the chronological age. So this was about the measurement of height and weight. Now the next point is the assessment of the nutritional status. So whenever a patient is coming to you and you are doing the general physical examination, then you also need to assess for the nutritional status of the patient. That is, whether the patient is undernourished, whether the patient is properly nourished or overnourished. So one of the factors to determine the nourishment of the patient is by checking for the height-weight ratio and by checking the BMI. But there are other factors as well that determine whether there is proper nutrition or nourishment to the patient or not. So this can be checked by various things. Number one, by checking for the dietary history. You have to check or ask the patient about his dietary history. That what are the various things that a particular patient is taking in his diet. Whether he or she is taking proper nutritious food or not. Whether he is taking different fruits and vegetables and various substances that gives him or her proper ample energy or ample nutritional requirement or not. The second thing is anthropometric measures. Anthropometric measures are basically the things that helps you to check for the various milestone development. So anthropometric is basically gives you the idea of the development of milestones or development of various height-weight ratios that we have already discussed, measurement of height and weight. So anthropometry means the measurement of head circumference, measurement of mid-arm circumference, hip-waist ratio. All these things have to be measured in the anthropometric measures to come at a particular diagnosis of the nutritional assessment. Then the third one is there are various biological markers. Various biological markers like the level of protein or albumin in the blood, this can be assessed for. The level of ferritin in case of iron deficiency anemia, albumin in cases of protein deficiencies in your diet, vitamin D level, vitamin B12 level. All these are basically biological markers which helps to understand or to demonstrate any kind of deficiencies in the diet. So this is about the nutritional assessment, how to perform the nutritional assessment of the patient, and this is to be done in this way. So these are the various points that are needed to be encountered in case of the general physical examination. Alright, so we need to ask about 10 important points in order to assess the general nutrition of the patient. Now, another step, first of all, we have to see by ourselves, we also have to check for the various sounds and things to check for the general physical examination. Apart from these things, we also have to check for the vitals. Vitals are various important parameters that are needed to be checked when a patient is coming to us. There are 4 important vitals that are needed to be checked whenever a patient is coming to us for the general physical examination. And these vitals provide us with an important patient. So various vitals are, number one, temperature of the patient, pulse, respiratory rate, and the fourth one is the blood pressure. So whenever a patient is coming to us for the general physical examination, we need to look at four important things: temperature, pulse, blood pressure, and respiratory rate. So the temperature, first of all, the normal temperature range is around 37 degrees Celsius and 98.6 degrees Fahrenheit. So if a patient is coming to us with a temperature below this range, then that particular patient might be in hypothermia. If the patient is coming with a temperature of 99 degree Fahrenheit or above 100 degree Fahrenheit, then the patient will be having pyrexia, alright, or we call it fever. So noting down the temperature provides you an important idea or important finding whether the patient is normal or that particular patient is having fever or any other disease. Temperature rises in many conditions. There are many conditions in which temperature rises, especially in cases of infections. Alright, to counteract the infectious organism, the body temperature raises by himself, and in this way, adverse conditions are produced for the living microorganism, and these are destroyed. So temperature range has to remain in an optimum range in the healthy individual. If that optimum range is not obtained, that means the patient is having some kind of disease. So you have to measure the temperature of the patient when a patient is coming to you for the general physical examination. The second is pulse. You have to measure the pulse. There are various sites at which the pulse could be measured. Number one, radial pulse. The most commonly observed pulse is the radial pulse. Alright, we use the three-finger method for measuring the pulse of the patient. We will be discussing the detail about the different types of pulse in another lecture. But here we are discussing only about the vitals. So we have to measure the pulse. Pulse is due to basically the upward movement of the flowing blood. That is the force that is exerted by the flowing blood on the blood capillaries. Alright, so this produces pulse. There are different sites at which we can observe pulse. Radial pulse, we can see the brachial artery pulse, carotid artery pulse, femoral artery, popliteal artery, alright, axillary artery. There are various arteries in which you can feel the pulse. And in the pulse, we have to check for the rate of the pulse, rhythm of the pulse, character of the pulse. We also have to check for the radiofemoral delay. All these things, the character of the pulse and all these things we will be discussing in another chapter when we will be discussing about individually about the pulse. The third important parameter or the vitals that we are going to discuss is the respiratory rate. So whenever a patient is coming to us, then we also need to check for the respiratory rate. There are many conditions in which the respiratory rate is disturbed. Many times the normal respiratory rate is 12 to 18 breaths per minute. If there is any kind of exertion, then the respiratory rate increases. And also there are many diseases where the respiratory rate increases considerably. The increase in the respiratory rate is known as the tachypnea, and decrease in the respiratory rate or the breathing rate is known as bradypnea. So these things we have to consider. Next important vital is the blood pressure. We need to check for the blood pressure of the patient. Whenever a patient is coming to us, we need to check the blood pressure by putting the sphygmomanometer cuff around the arm, and then we need to observe for the blood pressure. The normal blood pressure range is in the systolic is 120 to 139 mm of Hg, and diastolic is 80 to 89 mm of Hg. This is the normal range of the blood pressure that is observed in a healthy individual. So whenever a patient is coming to us, other than the 10 points I have discussed about the examination of the patient, we also need to check for these 4 vitals in case of a patient for completion of our general physical examination. So this completes with the general physical examination. When you are observing the patient from head to toe, you are looking for the facial appearance of the patient. You are doing all the 10 points that I have discussed, the different 10 points, and also examining the vitals, which includes temperature, pulse, respiratory rate, and blood pressure. So in this way, the complete general physical examination of a patient is complete, and then in the next lecture we are going to discuss about the systemic examination of another system. I hope you have understood this lecture properly. In the next lecture we are going to start with the second thing. So this was all for today. Thank you very much. Namaste.